Is squamous cell carcinoma a common bladder cancer? When we talk about bladder cancer, many people might wonder about the different types that exist. One type is squamous cell carcinoma, or SCC. So, is squamous cell carcinoma a common bladder cancer? The short answer is no. Squamous cell carcinoma of the bladder is actually a rare form of bladder cancer. It accounts for about 1% to 7% of all bladder cancers, depending on where you are in the world. In the United States and other developed countries, squamous cell carcinoma represents about 1% to 5% of bladder cancers. However, in some less developed regions or areas where certain infections are common, such as schistosomiasis, it can account for up to 50% of bladder cancers. This difference is largely due to environmental factors and the prevalence of certain infections. Now, what causes squamous cell carcinoma? Chronic irritation and inflammation of the bladder are strongly linked to its development. This can happen due to chronic or recurrent urinary tract infections, long-term use of indwelling urinary catheters, or bladder stones. Exposure to certain chemicals, like cyclophosphamide, can also increase the risk. In some regions, schistosomiasis, a parasitic disease, is a significant risk factor. When it comes to symptoms, squamous cell carcinoma tends to be more aggressive and invasive than the more common type of bladder cancer, which is transitional cell carcinoma. Common symptoms include blood in the urine, known as hematuria, irritative urinary symptoms, urinary obstruction, and sometimes weight loss. As for treatment, the main approach is usually surgical removal of the tumor, often through a procedure called radical cystectomy. Other treatments like chemotherapy and radiation may be considered, but their benefits are less clear. Unfortunately, squamous cell carcinoma generally has a poorer prognosis compared to transitional cell carcinoma because it often presents at more advanced stages. In summary, squamous cell carcinoma is not a common bladder cancer in most developed countries. However, it is an important subtype, especially in regions with specific risk factors. Understanding its association with chronic bladder irritation is crucial for bladder health and cancer prevention. If you have symptoms or risk factors, it is essential to seek professional medical evaluation for timely diagnosis and management.